Hello everyone, my name is Sakshi Jagdale. Today's topic urinary system. The urinary system is also known as the renal system, and the urinary tract consists of the kidney, ureter, bladder, and urethra. Uh, kid, Kidney is the kidney are kidney are two bean-shaped organs found on the left and right sides of the body in vertebrates, and they are located at the back of the abdomen. They are located at the back of the abdominal cavity in the retroperitoneal space, and the kidney pre- uh, kidney present uh, received area on the received area of the concave border is the renal ileum, and the kidney is surrounded by the tough fibrous tissue, the renal capsules, and the nephron is the nephron is the structural and functional unit of the kidney, span the cortex and the medulla. Each adult each each adult kidney contains around 1 million nephrons, and the in, uh, part of the renal cortex, a medullary rays, is the collecting of a renal tubules that drain into a single collecting duct, and the nephron is the microscopic structural and functional unit of the kidney. It is composed of a renal corpuscle and a renal tubule. The renal corpuscle consists of a tuft of capillaries called a glomerulus, and encompassing Bowman's capsules. A healthy adult has a 0.8 to 1.5 million nephron in each kidney, and then and then all the renal corpuscles, as well as both the proximal proximal convoluted tubules and the distal convoluted tubules found. Some nephrons have a short loop of renal that does not deep beyond the cortex, and renal corpuscle is the renal corpuscle consists of a tough capillaries called the glomerulus, and that is largely surrounded by the Bowman's capsules, and the glomerulus is the high pressure capillary bed between the afferent and efferent arterioles, and as a blood pressure through the glomerulus 10 to 20 through the glomerulus 10 to 20% of the plasma filter uh, between these sieve like fingers to capture the by the Bowman's capsules, and funneled to the PCT. PCT is the proximal convoluted tubule that is helps to filter fluid collect by the Bowman's capsules and enter into the PCT. Then it is called convoluted. It is called convoluted due to its tortoise path. Simple cuboidal cells. Simple cuboidal cells from this tubule with a prominent microvilli on the luminal surface, and forming brush border. This called microvilli, and then this called micro, and then loop of Henle. Then there are two types: the descending and ascending portion of the loop of Henle. The descending and ascending portion of the loop of Henle, The descending loop of Henle consists of a the descending loop of Henle consists of the uh, initial short thick portion and a long, and where the ascending loop of Henle initial short thin portion followed by the followed by long thick and long thick portions, and the descending thick portion consists of the descending thick portion consists of the simple cuboidal epithelium, and the ascending thin portion consists of the simple squamous epithelium. Then distal convoluted tubules. Distal convoluted tubules like the PCT is a very tortuous and formed by very tortuous and formed by the simple cuboidal epithelium, but it is a shorter than the PCT. Then these cells are not as active as those in the PCT. Thus there are fewer microvilli on the apical surface, and however these cells must also pump iron against their concentration gradient, then collecting the mhm. Then the collecting ducts are the continuous with the nephron, but not technically part of it. Each duct collect a filtrate from several nephrons for a final modification, and then they are lined with the simple squamous epithelium with the receptor of ADH, antidiuretic hormone or vasopressins. Then the kidney and the ureters are completely retroperitoneal, and the bladder has a peritoneal converting only over the dome, and as a urine is formed, it drains into the calyces of the kidney, and calyces of the kidney which merge to form the funnel shaped renal pelvis in the hilum of each kidney. Then pregnancy also increase the likelihood of reflux and UTI. The ureter are approximately 30 centimeter long. The muscular 30 centimeter long. The muscular layer of the ureter consists of the longitudinal and circular smooth muscles that create the peristaltic concentrations to move the urine into the bladder without the aid of the gravity. Then urinary bladder. The urinary bladder collect the urine from both the ureters. The bladder lies anterior to the uterus in females and posterior to the pubic bone and the anterior to the rectum. During bladder lies during late pregnancy, its capacity is reduced due to compression by the enlarging uterus, and resulting in increase the frequency of the urinations. The bladder is a the bladder is a partially retroperitoneal. Retroperitoneal volumes in adult can range from the nearly 0 to 500 to 600 ml. Mm, then uh, urethra is the transport urine from the bladder to the outside of the body for disposal. Then the urethra is the only urologic organ that shows the any significant that show any significant anatomic differences between the males and females. Female urethra, it's a short length, about 4 centimeter is less of a barrier to the fecal bacteria than the longer male urethra. and the best explanation for the greater incidence of the UTI in the woman. And male urethra, the length of the urethra passes through the prostate gland, and the immediately inferior to the bladder before passing below the pubic symphysis. The length of the male urethra is the length of the male urethra varies between male, but averages is the 20 centimeter in length. Function of the urinary system, that is regulation of the blood ionic composition. The kidney help regulate the blood level of the several ions, most important sodium, potassium, calcium, chloride, and phosphate. Then regulation of the blood pH, regulation of the blood volume, and the regulation of the blood pressure. The kidney also help regulate blood pressure by secreting the enzyme renin, which activate the renin, angiotensin, aldosterone pathway. The common disease is the kidney stone, urinary infections. Thank you.